Live, and it's Tuesday night, so that means there is a question and answer session going on somewhere around here. I don't know if you've seen it anywhere. Apparently with a top plastic surgeon. No? Okay. Right, well, if you've got any questions, you can post them. I mean, I don't know what's holding you back. Come on. It's wide open for you. There's an opportunity. But if you haven't, that's fine. It's fine. I will answer the questions that I have been pre-asked. Thank the Lord. I have a list here, and I'll get started with the list unless someone chips in. So feel free to chip in. So the first question goes something like this: how do I pick the right doctor for removal of a lesion? Right. Okay. Right. How do I pick the right doctor for removal of a lesion? Well, so I'm assuming skin lesion. So yeah, I guess broadly speaking, there's two different types. There's dermatologists and plastic surgeons are the two types of doctors. I've done something about this. Was it a video or a blog post? No, it was a Canva. I did a thing on Canva about this. Anyway, dermatologists, plastic surgeons. So dermatologists are probably the point of call for most kind of skin stuff. Dermatologists are specialists in skin conditions and can sort of see you with any skin condition, and they can also remove skin lesions. Plastic surgeons, like myself, tend to get involved mainly just for removal of skin lesions. So we just, broadly speaking, we just remove skin lesions. We're surgeons. We're surgically trained. We go to the operating theatre and do other types of operations. Dermatologists are medically trained. They're not surgically trained, so they are more involved in the medical aspect of things. So certainly, if you need any creams, any non-surgical treatments like cryotherapy and curettage and peels and things like that. I know plastic surgeons some of them would do that sort of stuff, but that's, I guess, more the remit of dermatologists. If there's multiple lesions, things like rashes and what have you, dermatologists are a lot better suited to see and treat those sorts of things than plastic surgeons. I hope I'm not upsetting any plastic surgeons out there. Maybe I'm just speaking for myself, but I would mainly be involved in removing of lesions. So removing of a lesion could be done by a dermatologist or a plastic surgeon. We would certainly, if it gets bigger, skin cancers, when things need to have some tissue moved about, what we would call a local flap or a skin graft, that would be plastic surgeons. I think that dermatologists, some of them do that sort of stuff. But plastic surgeons, all plastic surgeons will do that because, as I say, we are surgically trained and much more heavily involved in the surgery aspect of it. So then, if you kind of need something removed, then I guess you're more towards a plastic surgeon. If you need something diagnosed, or you're thinking it doesn't really need surgery, you're wondering whether it can be treated with some kind of topical agents, then there'd be more of a dermatologist. So I hope that gives an idea of the kind of spectrum. You could always see one, and if they felt the other was more appropriate, they would refer you. So there is a bit of overlap. And so, it's not uncommon for me to say to people that that's probably more appropriate to be seen by a dermatologist, and dermatologists might refer people to plastic surgeons if they need bigger operations or bigger treatments. So yeah, that's the main types of people: dermatologists and plastic surgeons, and that's, I hope, a bit of an overview on who you should choose. Can a mole or cyst grow back after removal? So, well, they're separate things. So a mole, the answer is yes, they both could. A mole, then there's two different ways to remove a mole. There's a shave excision or a formal excision. A formal excision cuts it out. So a formal excision usually cut the whole mole out. So it's not going to come, unlikely to come back after a formal excision. But a shave excision, you just take the top half and you leave the bit that's sort of underneath the skin behind. And so some people do worry about them coming back. In my experience, they tend not to, because you would only do a shave excision of a benign mole. You wouldn't do a shave excision of of anything you're worried about, any sort of malignancy or cancer. And benign moles don't tend to grow very fast, so you can just take the bit off the sort of above the skin, and the bit below the skin tends not to grow back. Sometimes you don't get it all out, so there's a bump left behind. That's not it growing back. That's just not getting it all out. So sometimes you need to do it again. But on paper, I guess it could grow back. So that's why some people don't like the thought of a shave excision. In which case, fine, you can have a formal excision. There's no right or wrong, and there's often a discussion to be had about what type of excision. In terms of a cyst, that's slightly different, because a cyst, you always aim to remove all of the cyst and all of the cyst wall, which is why the incision needs to be made about the size of the cyst. Sometimes you might see people who make these tiny little incisions and kind of take all the stuff out of the cyst, and then try and take the cyst wall out. I think that's very hard to get all of the cyst wall out in those circumstances. It's much easier to get the cyst wall out when the cyst is kind of intact. So if the whole cyst wall is removed, then it won't grow back. But if it's not, then it could grow back. And that's more of a surgical thing. When we do the surgery, we will always try and remove all of the cyst wall. Sometimes it can be difficult, particularly if the cyst has been infected in the past, or worse still, if it's infected currently. A couple of times I've removed cysts where I haven't thought it was infected, or you kind of think, oh, it's a bit red, but maybe that's because they were just squeezing it or something, and you kind of convince yourself it's okay, and you actually do the surgery and it's not okay, and it's all a bit like sort of not watery, like friable. That's a good word, friable. So the wall's very friable, so it's not easy to get the whole wall out, so you get it out in bits. So in those circumstances, you say, look, it's really sorry, I got the wall out in bits. So if I've left any of that wall behind, it can come back. So in those situations, it could come back. But if you get it all nicely out, which is the majority of the case, I've got to be honest, you try and get all of the cyst wall out. Then if you get all of the cyst wall out, then it won't come back. No guarantees in this world, but always do our best to make sure they don't come back. But I say in those circumstances, there is a risk of it. Can I drive myself home after the procedure? Well, yeah, most people do. Now, the local anaesthetic says you shouldn't drive for 24 hours afterwards, but you drive yourself home after a dentist, don't you? Dentists never tell you that. So most people do. But if you ask the question, well, it says on the local anaesthetic you shouldn't drive for 24 hours afterwards. But as long as you're feeling okay, then you can. I mean, especially if you're having a bigger thing, it's probably best and nice if you can have someone drive you. But I know that's not always possible. But if it is possible, I think it'd be nice to have someone drive you home. But I know that may not be possible in every case. So if it's not possible, then yes, you, and as long as it's not too far and things, should be able to drive yourself home after the procedure, as long as it's not something on your eye or something like that, or in your hand or something. I don't know. I mean, get in touch and ask us. But broadly speaking, yeah, you usually are able to drive home. Can I exercise or shower normally after lesion removal? Okay, so exercise. I mean, take it easy. I mean, it depends on it. So sometimes we do some really big things. I guess you're talking about a smaller thing, like a big thing. A lot of this stuff, I don't have to say. If we do a big thing, you're not going to feel like exercising straight after. So a lot of it is just listening to your body, to be honest with you. But usually, yeah, you're just gentle exercise, I suppose, nothing too crazy, especially if there's something on your face. I normally say to people, you don't want your face to go red. So if you're bending, stooping, doing like a bench press. Actually, are you bending, stooping with a bench? Is a bench press when you're lying on your back? Okay, maybe a bench press isn't a good idea. Bending and stooping, doing a clean and thrust, is it? Anyway, if you're bending and stooping and lifting up a heavy weight, whatever that's called, that basically if your face is going red, let's keep it at that. If your face is going red, then that's not good. So if you're lifting something off the floor, heavy thing off the floor, basically, if you've got something on your face, stitches in your face, it might make it bleed. So just take it a bit easy. Also, if you've got something on your body and you've got a waterproof dressing, you don't want to get all hot and sweaty because the waterproof dressing doesn't breathe. So that's on for a week. So for the first week, you kind of want to take it easy a bit. In terms of showering, yeah, the dressing on the body is usually waterproof, splash waterproof. The face, we tend not to use a dressing if you've got stitches in your face, so you can wash and shower normally. If you've had a shave excision, then you do have a little dressing on for a few days, so you won't be able to shower for those few days. Then that dressing comes off and you have a bit of ointment on it. So for a few days you won't be able to shower for a shave, but for a formal excision, then you will be able to shower, whether it's on your face or your body. Are there any non-surgical ways to get rid of a cyst or a lipoma? Non-surgical, not that I know of. No, I mean, these are subcutaneous lesions that are underneath the skin. Non-surgical ways, I mean, they do the fat dissolving things, don't they? Like the freezing and stuff. But I don't think there's an application for those for lipomas. Those are non-surgical ways to get rid of fat, but a lipoma is a discrete lesion. So I might be wrong on that. So I don't want to get I don't want to do anything libelous about the non-surgical fat removing people, whether they might do it. There is a non-surgical fat removal machine or machines. There's several machines that do it, but I think they're, certainly from what they've spoken to me about, they mainly use the application as being someone who wants to remove areas of fat for sort of cosmetic reasons rather than a lipoma. So yeah, I don't know of any non-surgical ways to get rid of a cyst or a lipoma. Surgery is the only answer as it stands. I'm sure they'll create a tablet one day or something, but as it stands, surgery is the way. But you don't have to have it removed, of course. So you don't have to have surgery if you don't fancy it. You can leave your cyst or lipoma, and it's probably not going to cause you any harm. Sometimes cysts can get infected and stuff, but nothing too drastic. So, can cyst lipoma mole removal be done on the same day I come in? Yeah, that's the whole point of what we do. So one of the big thrusts of what I've tried to do at the clinic is to make a see and treat service. So the see and treat service means exactly that. You have it done on the same day as your appointment to try and stop appointments. I kind of think of it from myself point of view. If I've got something, if someone can, if you take your car in and they diagnose it and they say you've got to come back another day to fix it, it's a bit like, can't you just fix it now? It's a bit. So that's kind of what the see and treat clinic is based on. It's based on the car thing. Car people should do that more. Come in, let's have a look, let's have a chat. This is what's needed. What do you think? Do you want it today? If you don't, fine. But if you do, we're ready to go because we've got we've got an operating theatre because it's my clinic. I used to work in the hospitals, and it's not my operating theatre. So you have to book the operating theatre in those places, so you can't do it there because you have to book the cases in. But because it's just there, the operating theatre, we just said, look, let's do these appointments where we block out a load of time. And to be honest with you, not many people don't have it done. There's no pressure. You don't have to have it done if you don't want to, or if you're going on holiday, or if it's a bad time, that's fine. But I think it's been pretty good. I think it's good for patients. So I think it's something that resonates with people, and especially skin cancers, because people are worried about those, and they've been told that they're going to get seen by the NHS, and then they take a photo and they send it off, and then maybe they say you see a dermatologist, and the dermatologist says you might have to see a plastic surgeon, and each of these things is like weeks and weeks in between. Whereas you can come and see a plastic surgeon straight off the bat. We'll have a look, and if it needs removing, we'll just remove it there and then on the day. As I say, especially with some of these skin cancers, because some of them can be nasty, and you want to get them off as soon as possible. So that's one of the sort of mainstays of what I did at the clinic to try and make it same day service, same day treatment. See and treat, we call it. I don't know if that makes it clear. Same day. Maybe we should call it same day, but we didn't. We called it see and treat. I say we. It's all on me. I called it see and treat. Sounded good at the time. So that's that. I'm out of questions. I will leave this room in a minute, unless anyone's got anything to say or ask. But if you have, don't worry, just post it or email us. And if you're lucky, if you're lucky. You might get on next week's show. Who knows? So I got a flash goal. What's a flash goal for you? What does that mean? Okay, so yeah, thanks for coming, everyone. Do very much. It's not gone unappreciated. 3 gifters sent Rose to your live in 15 minutes. Activate the goal. I don't think I'm going to be in 15 minutes. I'll say not now. So yeah, I'm going to go and leave this room. Actually, I might stay here a bit. I might clear my desk up. But anyway, it's irrelevant what I'm doing right now. I'm going to stop the stream. So I will see you back. Oh, what's that? Follow. We'll see you back. I like that one. No one ever does follow though. What's the point in that? What's that? Yeah, probably that one's a bit more subtle. Keep the subtle one. Okay, I'll see you next week. And I will bid you good night. I hope you have a nice evening and sleep well tonight. And